HSRR. All right, we are going to be recording this meeting so that we can go back to it. One of the really nice things about our events having been virtual the last couple of years is that we've been able to make them more accessible for people who aren't able to be here in that moment. So we're recording just so that everyone is aware. Thank you all so much for being here to our Health Services Research Roundtable group meeting. We haven't had an event in exactly 1 year. Today was the last time that we had an event. So we're really excited to have another one and to be with you all tonight. So tonight's topic is going to be on strengthening Eastern Washington families. We're going to be talking a lot about trauma-informed care and different trauma-informed models and approaches, as well as kind of some resilience and strength-based models. A little bit about the Health Services Research Roundtable. Health Services Research Roundtable is a collaborative effort that involves each of the different institutions of higher education in the Spokane area. So we have representatives from all of our different universities who really come together in origin to help facilitate collaboration across universities and to facilitate collaboration with community partners in doing research that really impacts our local community and facilitating that use of data and use of research support for our community. So Health Services Research Roundtable started in 2016 and has evolved and grown to continue to have each of these universities involved, adding different medical schools in the UW-GU partnership and evolving just as our higher ed community in Spokane has evolved, and evolving in kind of the style of the events that we're holding. Traditionally, we've done a lot of different in-person networking events, and with COVID shifted into these virtual panel discussions, and which we'll be hosting again tonight. And in the future, keep an eye out for some of those in-person events that we will do as well. I'm going to jump us into sharing a little bit about our presenters, and I will look for ask maybe to get a message when we have our final presenter on as well. Okay, so tonight we're going to hear from a lot of different individuals. We're going to hear from Vicki Ybarra with the Washington Department of Children, Youth, and Families. Vicki is the director of the Office of Innovation, Alignment, and Accountability with the Washington's DCYF. We're also going to hear from Amy Napton Vega, who is the executive director of Vanessa Behan. We're going to hear from Dennis Cisco Taylor, who is an assistant professor of school psychology at Gonzaga University, and Rumyana Kideva, who's an early childhood specialist with the Healthy Living Program of Spokane Regional Health District. So we've got a lot of diverse community partners and higher education representatives to share a little bit about each of their unique perspectives in this area. We're going to have a panel discussion, which is going to be moderated by Jennifer Hansen, a health program specialist with the Beginnings Matter program at Spokane Regional Health District. So those are each of our presenters, and I am going to kick it off to one of our presenters to get going. So I am going to, I think we're waiting on one presenter, so I'm going to see if we can have Amy actually go first for Amy's presentation. Thank you all so much for being here.
Can I clarify, are you asking for me, Amy Vega?
Oh, yes. And I just realized I don't think that you have a presentation.
I was just going to say, yeah, I'm not actually presenting, just panelist.
All right. Thank
Correct.
you so much. I apologize for the confusion.
That's okay.
Rumyana, can we have you go ahead and go?
Of course, I would love to.
Awesome. Thank you for starting us off.
And I will share my presentation in a second with you. I think while I'm trying to find, where is it? With all my open windows. I just wanted to tell you a little bit about our program. So I am part of the Healthy Living programs at the Spokane Regional Health District. And I am also working with Jen Hansen, who is going to be facilitating the panel discussion. And we've been working this program about 2 years now. It is a continuation of previous efforts in maternal child health funded programs from Spokane Regional Health District. But the unique part of our Beginnings Matter program is that we are focusing on county-wide reach to working with different community providers, organizations, advocates for community resilience around supporting families with young children. And you can see our contact information here. So again, today is just a very brief overview of the HOPE framework and how it can be an addition to what you're already doing, and how does it fit in at all, like with the trauma-informed care model that we are all familiar with. But if you have any more questions, we would love to talk to you, either do more of an in-depth presentation on the HOPE framework, or even just talk to you about how does it fit in what you're already doing. So as I said, we're part of the Beginnings Matter program, and our focus is on supporting communities in Spokane County to convene around family and children's health and well-being. So all families and children have access to equitable healthcare and social services, education, and everything, kids and families needs to thrive. We do this through system level environmental, changes, policy, advocacy and changes. So we don't provide direct service, to the families and children. But as I mentioned earlier, we work with providers in the community who are engaged directly with families and kids. So this is just a reminder of how the trauma-informed care is organized around the same 6 principles of trauma-informed work. It is an approach. It's really just a broad framework. So it doesn't give us necessarily what to do from trauma-informed perspective, but it tells us how to do that, how to do the work. So as probably all of you are familiar, those principles are around ensuring safety in the ways we provide care and services, also maintaining trustworthiness and collaborative spirit of the work we do with families, ensuring that there's plenty of opportunities for engagement, reciprocal also engagement with the work, so families and children feel empowered in decisions they're making about their care. And it's really one of the main principles also is around families and children are in anybody, individuals, they are the experts of their life and of what they need, and they're capable of meeting their needs as well. So there's a big focus around peer support, not just for the communities we serve, but also for the professionals who provide that service and care. And of course, everything we do is oriented around the historical context of our trauma and community trauma and intergenerational trauma transmission and so forth. So why I wanted to start with this is so you can see how the HOPE framework is really like touching on all those 6 principles, and is not something in addition to the trauma-informed care that organizations can be doing, but it's actually a flavor of trauma-informed care. It's a nuance of what we do. So a big piece around trauma sensitive work in trauma services has, especially in early childhood, has been focused on how do we address adverse childhood experiences, ACEs, and then what do we do to prevent them? So the first, several, 2 decades of that research was really focused on that tree, the crown of the tree, on the individual experiences of ACEs. So what happened in the family, in the household, and how did that impact children's development and, lifelong health outcomes. So the new research that's coming from public health field was around actually adding the community aspect of adversity, saying, something that we all know as practitioners, that families don't experience trauma and adversity in an isolation. A lot of the adversity that families deal with is because of adverse community experiences and conditions. So we have to ask ourselves about what is it in our community and what is in the soil of our community that is feeding the adverse childhood experiences in the families. So as you can see here, this model of pair of ACEs, it was coined by Dr. Wendy Ellis from George Washington University Center for Community Resilience, and it really takes that big system level approach to adversity, and then not just identifying where adversity happens, but also how do we address the soil of our communities, and how do we work that soil so it promotes health and prevents against adversity. So the good news is that we have the HOPE framework to do that. So we're using the HOPE framework from a perspective of from understanding that we all have a role to play as a community, as community members, individuals and professionals, and we can find, what really our strengths are and what our gifts are and talents are to provide supports or access or create, new opportunities for families and children to experience positive experiences in their life. So the framework stands, the HOPE framework stands for Healthy Outcomes from Positive Experiences, and it was developed by the Tufts Medical Center for Community Engaged Medicine. And now the center is called HOPE National Resource Center. And it's based off the assumption that the positive is real, it exists, and it's worth growing and supporting. In our communities, it used a lot of research. Probably you'll be familiar with it, from strengths-based approaches around strengthening families also that DCYF is using, and a lot of the research behind thriving youth and families. So there's really no, I would say, new knowledge per se theoretically, but the research they did in 2015 is where they kind of mimic the ACEs study. In Wisconsin, they did a population study where they asked retrospectively folks about their childhood experiences, adverse and positive ones, and then they correlated those with their current mental health status. And they found that indeed, positive experiences are protective against adversity, and even in the presence of adverse childhood experiences, it promotes health in the in long-term outcomes, and some of those conclusions were that actually the absence of positive experiences is much more damaging than the presence of adverse ones, which we all I think know from from practice and experience. So how exactly do positive childhood experiences protect against trauma and adversity? Is through building connections, relationships, and opportunities for families and children to engage with in safe and supportive environments. positive experiences strengthen the resilience, the individual level resilience and the family level resilience, but also positive experiences are more likely to occur when we have a robust, resilient community. So it's kind of like, like that process of, reciprocity that we want to have in trauma-informed approaches. So those positive experiences can be very loosely grouped in 4 different building blocks. The first one is of having access to positive, supportive, nurturing relationships with adults, caregivers, or somebody outside of the home, like teachers and coaches, neighbors, and also with peers. So when we're talking about this building blocks of hope, we do really refer to children having access to them, but also we talk about the adults, the family who is caring of their child, having access to such building blocks of hope. Here we see the other building block, which is of environment. So people having access and children and families having access to safe, supportive environments where they can live, learn, and play. Engagement is my personal favorite one, is where folks have opportunities to engage with something bigger than them. So it can be either through sports or other civic engagement or faith or culture. And that is healing and promotes resilience within the community. And then the last one is the emotional growth one, where kids and families, again, adults, everybody around kids have access to opportunities to explore freely their environments in safe ways, learn through play, learn through engagement with, various activities like art, music, and so forth. So here, just like in summary, is a reminder that yes, these moments of hope can happen intentionally because we work, to introduce them in the lives of families and kids that we provide services to, but also a lot of them happen naturally because we are the way we are. We're social creatures. We seek each other, and we offer support to each other. So a lot of them are just really literally that, moments of hope, moment of quick connection with somebody, an exchange of a smile, of a good word, or offering support, to a parent with a young child when you see them in the store. Those moments of hope are very important to happen in our exchange from the first time, even before we see a family, to provide services. So it's our public facing materials, our intakes, assessments, when we're designing our policies, programs, and so forth, just like trauma-informed care urges us to do that. So in summary, hope is a strengths-based, child-centered, and family-led framework. It gives us immense opportunities to create and to work towards what we want to see in our communities. Here's just some more resources I want to share with you if you're interested in finding out more. And again, please reach out to us. We'll be happy to talk more about the framework.
Rumiana, that was so great to hear about the Hope Framework. I think what we'll do right now is just leave it open for a few minutes and just see if there are any questions about the Hope Framework for Rumiana. You can feel free to add those in the chat, or you can just come on mic.
That was great, Rumiana. This is Jen Hansen from the Health District. And I just wanted to share that the researcher who coined the pair of ACEs, Dr. Wendy Ellis, will be in Spokane on April 20th and April 21st. And I will send you the link, Ashley, to send out to everyone. It's she'll be talking about her building community resilience model, and we'll also be doing a Hope 101 presentation and a workshop about how it could be applied to your work. So, and we'll also have local data from the quality of life report. So anyway, just wanted to put a plug in there.
Awesome. We can definitely share that with those who are attending and with our list. Thank you so much for sharing that. Any other questions for Rihanna? We will have more time and organized questions around our panel discussion as well.
Feel free to pop questions in the chat as well. If there are not any, I can briefly introduce myself and then move on to introduce the next speaker. So my name is Brittany Bannon. I'm a senior research scientist in the Spokane Regional Health District's Data Center and co-facilitator of the HSRR Steering Committee along with Ashley. And so it is my pleasure to introduce the next speaker. So as Dr. Vicky Ibarra is the director of the Office of Innovation, Alignment, and Accountability at Washington State's Department of Children, Youth, and Families. She's an expert in child and family health and policy, and recently had shared some really powerful data with some of my team. And so we're thrilled to be able to have her join us today and share some of that local data. So what she'll be doing is providing a local snapshot of health, child and family health in Spokane County, as well as some of the prevention efforts that have been going on in the state. And you can kind of see through some of those HOPE principles. So without further ado, and Vicki, feel free to fill in any gaps that I missed there, but welcome.
Thanks so much, Brittany, and thanks for the invitation. I'm so pleased to be here today. As Brittany said, I am director of the Office of Innovation, Alignment, and Accountability, which is all things data and research at the Department of Children, Youth, and Families. We're a relatively new state agency. We were formed in 2018 by bringing together child welfare, early learning, and juvenile rehabilitation, which had existed in 3 separate entities in the state, with a mandate toward prevention. The legislature and the governor believed that if we brought these agencies together, we might actually be able to leverage expertise from each to prevent bad things from happening to kids and families. And that's certainly one of the reasons that I'm here. I'm an old home visiting nurse by training and spent most of my career in Central Washington in the Yakima Valley doing home visits and building community health systems. And the opportunity to build prevention into our systems is one of the reasons that I came to work for DCYF. So I'm excited to be there, and I'm excited to be here with all of you today. In the time we have, I hope to share some information with you. I brought some data, and I have to tell you, I had to cut down my slide deck quite a bit. So I've got a longer version of this slide deck if anyone's interested. I'm going to talk specifically about 3 opportunities related to supporting families and preventing maltreatment. We're trying to prevent maltreatment by building strength, and I love the wonderful positive framework that was presented. I think we would agree that's absolutely what we want to see happen in communities too. I do have to say before I start that Spokane has been, especially the city of Spokane, the area surrounding the city, has had among the highest rates of maltreatment in the state for some time. I did not bring that data today, but if we go back and look 20 years, Spokane has certainly been in the highest. Doesn't mean that there aren't a lot of great things happening for families in Spokane. We know there are, but we also know that there is a lot of risk for families and kids, and I have some of those data here for you today. I'll talk a little about our work with what we call the age 0 population, infants and young children. And this is, I believe, some of the information that Brittany mentioned we've recently shared with some of her team members. Also going to mention some policy changes and the opportunity to support families who may no longer be entering our system because of policy changes happening later this year. And then mention Strengthen Families Locally, of which Spokane is one of our pilot communities. So in terms of looking at children who enter out-of-home care, who enter foster care, this is a snapshot of our calendar 2021 data. And you can see here just by age, the portion of those children entering care by age this was startling to me when I first started at DCYF. I was aware of the child welfare system. I had done some alternative response when I was doing home visits in Yakima, but I was not aware how very skewed those entries into care are to the age 0 population. These are infants who haven't yet turned a year old. In fact, I found out that Washington State is among the top states in the nation in terms of the percentage of children entering care who are infants. I think we're number 3 or 4 in the country. Although this trend persists throughout the state and throughout the nation, it is fairly extreme in Washington State. And in, as we see here, in Spokane County as well. This is a brief snapshot of the children age 0 to 1, infants and newborns who came into our child welfare system from Spokane County during calendar 20 and 21. And these years are lower than previous years. We did see a substantial decrease with COVID that has now recovered, at least in terms of intakes. The number of children entering care continues to decrease, which we think overall is good. But these numbers are necessarily after COVID hit. You see here on the top the number of total screened in intakes. That means an intake came in to the child welfare, the child maltreatment hotline, and it met statutory requirement for a child protective services response. It meant that the child was at risk enough that we needed to mount a CPS response. 735 in 2020 and 710 in 21. You see below that the number of those children who were subsequently placed in out-of-home care, and those who were placed in out-of-home care who had parental substance use as an indicator, as a risk indicator for their safety. So it was a contributor to their being placed into care. And then the same breakout for those in the first 30 days of life. So most of this, not all of it, is happening in the first 30 days of life, much of it related to parental substance use. We can look at the race ethnicity of those children. This is the whole age 0 to 1 population, calendar 21. As we can see, most of those are children of color. The way that we do report on race ethnicity based on some work we did at the beginning of the agency with our stakeholder communities and tribes is we disaggregate, we make an attempt to disaggregate the multiracial category. So the American Indian population here includes biracial and multiracial American Indian children, same with the Black community. And we have a paper on how we do that and why we did it, but it's consistent in all of our data. If we also have mounted a pilot project to try to prevent as much as we can the placement of infants related to substance abuse. With the creation of DCYF and House Bill 1661 that created the new agency, it provided an opportunity because of our mandate for prevention to offer voluntary prevention services to families and screened out referrals. So we chose this population, the population that are being screened out during pregnancy, because there's no child present. We have about 800 of those referrals statewide a year. And we started a small pilot, including Spokane County. We identified the offices with the highest numbers of those infant placements with substance abuse as a contributing factor, mounted a pilot where we partner with community agencies who receive those referrals, and then conduct some resource referral function to assess needs and make referrals to community service organizations based on the services that the client needs and is interested in, including but not limited to substance treatment services. In Spokane County, we partner with You Are Not Alone at the Regional Health Department and also the American Indian Community Center. We added a tribal pathway in some communities, including Spokane, including Puyallup. We're currently expanding to King County, and statewide spread of this pilot, we're very pleased, is in the governor's budget to support the referral, funding to support the referral and resource function. So we're fingers crossed, hoping it ends up in the state budget approved this legislative session so that we can spread this very successful pilot to the entire state. sorry, having trouble with this. All right, House Bill 1227 was enacted in 2021, and it raises the standard for child removal just a bit. It raises it to an imminent physical harm standard from an imminent danger standard. You know, to the untrained eye, those sound a lot like the same things, but I'm told it will result in fewer children entering care, as is in the intent of the legislation. We're not quite sure which children that are currently entering care will not be entering care under the new standard. It's really up to how local judges are going to interpret the standard, but we've estimated that the change could impact up to 12 to 21% of children placed currently in out-of-home care based on our analysis of 2021 data. We think that means families who have neglect indicated, but not a lot of other risk factors indicated, may not be entering care, and that's a lot of families. Now, when neglect is indicated and no other risk factors are indicated, it still means it's affecting the child's safety. So we never recommend placement of a child if neglect and poverty are the only issues, but if they can't be remediated and they continue to affect the safety of the child, we think that those may be the types of cases that may not be placed. Again, it's going to depend on interpretation of local judges. So as we were considering what these families might look like and how we may be able to provide alternative or supportive services, we did some analysis of neglect and other kinds of referrals to court. And I brought for you today the Region 1 profile. This is based on 2021 data, but we had 113 placements that had neglect as the only indicated factor in this long list of potential contributing factors. Most neglect factors, most cases that have neglect indicated also have another factor indicated, most often substance abuse, and neglect and substance abuse tend to go together. But as you can see here, there are a variety of other contributing factors that could be in play for a family. Again, we see the leftward skew of the data so that many of these children are infants, 52% are under 5 years old, 28% are infants, and you see there the racial ethnic breakdown of those children. Strengthen Families Locally is a community-based primary prevention project that we were funded for 5 years in 4 communities around the state. What we did was including the city of Spokane, we looked at the data. RDA produces nice longitudinal data on child maltreatment rates from around the entire state. And what we did was look at all of those communities. We identified the 23 or the 20% of communities that had the highest rates of maltreatment in 2018. And from those 23, we chose 4 at random. And those included Spokane, Stevens Ferry County, Port Angeles, and Bremerton. And this is the model is largely based on the Strong Communities for Children that has shown some efficacy. We conceptualize that the primary intervention is not individual family-based services, although we will be and do fund family-based services through this intervention based on what the community says they need. But we conceptualize that the primary intervention is happening at the community level. It's engagement and activation of families and community members directly in their community to engage with their data, to engage with one another, to have a chance to process and think about what their community needs, to ask for what their community needs collectively, to ask for what their community needs, identify that need, and then to have that need met. So we meet the needs that they identify through the funding from the federal grant, but we've also engaged philanthropy from around the state to fill the gaps because we knew that the federal grant wouldn't fund everything. And we've been able to invest substantially in community priorities in Spokane, as well as the other communities. I've given you here the website and the references if there's interest. This is a very public-facing project. All of the program documents are on the website. Lots of newsletters and interactions go back and forth with the communities, and there's a ton of engagement. So We're really happy with this project. I serve as the lead evaluator on the project. And because we chose the communities at random, we expect to be able to identify causal mechanisms by which the hopeful decrease in the rates of maltreatment will happen by the end of the intervention. And that is a short version of what I have for you today. I have my contact information here. I'm happy to follow up and engage in any additional conversation that might be of interest. Thanks.
Thank you so much, Vicki. That was so interesting to hear about Spokane County and the state. And thank you so much for sharing kind of the background of DCYF and all of such great information for us and about strengthening families. I'd just like to open it up and see if there are any questions specifically for Vicki before we get started with our panel. All right. Yes, I have one comment and question from Vivek, which brings up the slides and different presentations. We're happy to, hopefully, I check with both of our presenters, but I believe we have copies of those presentations and we can attach those in the follow-up to this meeting that we do, along with kind of our evaluation survey of the meeting as well. So we can share the presentations, the link to this video as well, and everyone can dig a little bit deeper into those. I am going to introduce and hand this off to Jen Hansen now to have our moderated discussion. If there are additional questions for throughout the moderated portion of this or for any of our presenters or speakers, feel free to please add those in the chat and we will get those to each presenter. So we will add those. We have one question that just rolled in that I'll hand off for Vicki right now while we ask all of our other panelists to join us on screen. And that question is, how does homelessness as a risk factor play into these data? So it would be great if Vicki, if you could answer that, and then I will hand this off to Jen.
Thanks for the question, Georgina. Inadequate housing is a risk factor, absolutely, for children being safe and for families entering the child welfare system. If you take a look, once you get these slides in the profile on neglect as a contributing factor to out-of-home placement, you'll see that inadequate housing is also a risk factor. It was identified as a factor in 14% of placements that occurred from Region 1. That's not just Spokane County, our entire Region 1 in 2021. So it is a factor, 14%.
Thank you. Yeah, with the rise in homelessness in general, I wondered if that influenced some of that data too. Thank you.
Great. Well, thank you. I'm very excited to be here moderating this panel, which has some of my favorite people on it. And I would really love for Dennis and Amy to introduce themselves since we had a chance to meet Rumiana and Vicki. And Brittany and Vivek, are you on the panel as well?
No, I'm not. I'm just.
Oh, okay, perfect. I just wasn't sure if that's what was popping up on my screen. Sorry. Do you want to be? Come on.
I trust you.
So yeah, Dennis, if you could introduce yourself, I would love that.
Sure. So I'm Dennis Cisco Taylor. I'm an assistant professor in school psychology at Gonzaga University. Before coming to Gonzaga, I spent years as a practicing school psychologist in public K through 12 schools. And now I take part in training school psychologists and helping schools with professional development. And developing multi-tiered processes, which we'll talk a little bit more about tonight, I think.
Fantastic, thank you. And Amy?
Yeah, hello, I'm Amy Napton-Vega. I am the executive director at Vanessa Behan. I have been there for 26 years and worked directly with our children, worked in our program department, overseeing all the programs we do with children and families, and have been the executive director for about 15 or 16 years now.
Wow, thank you. This is such a wonderful panel of people. I'm excited to get to the questions. So I will ask the first question. You will each have about a minute and like 10 seconds to answer. So just no pressure there. But I would love to start with Amy and then work backwards on my screen since we haven't heard from you yet. And so the first question is, speaking from each of your experiences in supporting families and children, what makes families and children resilient?
Well, in a minute and 10 seconds, Jen.
No pressure.
Exactly, not at all. And hopefully we will build on each other. But I would say really, just like all of us, when we practice hard things and we get it right, we get better at it. And so we want to give our children opportunities to practice and fail and try again. I think about skiing, right? When you go skiing, you have all the right equipment. You don't show up with a sled to go skiing. You have the right equipment. So you start off with a solid foundation and then you practice. You don't go straight to the black diamonds. You start off on the bunny hill and maybe you get a lesson. So I think resiliency is built over time and over practice. It doesn't something that just happens naturally. And so we have to give children and families opportunities and the support and the proper support systems. I think oftentimes that's missing for our families.
Well said, Amy. Dennis, how about you? What's your take on what makes families and children resilient?
Sure. Yeah. So I place these things in a couple of different buckets. I think there are protective factors that contribute to resiliency, and we've heard these mentioned in some of the other discussions. So things like connectedness to families or schools or communities certainly helps. Strong communication within families definitely helps facilitate. And then some of those internal characteristics of resiliency. I guess I'll talk about these by talking about what takes away from resiliency, right? So things like negative thinking, right? Having negative schemas for things and being avoidant about situations. So kind of counter to that, right? So taking things head on, not being avoidant in certain situations, right? Learning to reframe things positively over time and having a positive outlook on things. Not necessarily a rosy outlook, but not an overly negative outlook. Definitely helps with resiliency.
Great, thank you. You have a lot in common with Rumiana. Rumiana, do you want to go next?
Gonna be a lot of overlap, I think.
Yeah,
Yes.
great.
Yes. So that's actually what I was thinking too, is around and I tell my kids as a parent, some people are just born lucky, they lucked out of the genetic roulette, they have all those qualities about themselves. They're more optimistic thinkers. They're more like go-getters, they want to challenge themselves even when something's harder. Funny enough, I have one child who's exactly that, and he thrives, doesn't matter where we go. And the other one is super cautious, very negative about his own skills. And even when he exceeds, he would self-critique about how he's done that. So yeah, sometimes we're born with that, but really how I grew to understand resilience through mental health practice and research and just personal experience of being an immigrant is really through relationships. So we get to grow our resilience skills and exercise that resilience muscle through relationships. And that's individual level, but also through the sense of belonging and the sense that we matter to our community for who we are, not just for what we contribute to the community.
Great, thank you. And Vicki, how about you?
Thanks. I certainly would agree with much of what's been said. I'm always reminded when we talk about resilience in kids, I'm always reminded of the work of Deborah Phillips, who's an early learning researcher in child development, who encourages us, rather than thinking about resilience as a characteristic of a child or an individual, to think about it as a characteristic of a relationship or a context, because resilience develops and exists in the context of relationships and context, the communities we live in. So I think if we think about it that way, it supports much of what my colleagues have said here today on the panel.
Mm-hmm. That was a beautiful closing. That wrapped it up. Perfectly. So the next question, and I'll start with you, Vicki, so you don't feel like your thunder's stolen by the time you get to go. The second question is, from each of your perspectives, what do you see as the biggest areas in need of support for children and families in Eastern Washington? So what are the biggest areas in need of support?
Yeah, so I've lived long enough and had a long enough career that I have come to believe that while I started my career working directly with kids and families and building health systems, I've come to believe that everything is about the social context and the policy environment. And that's where I think our greatest needs are. As I said, I spent most of my career in Yakima County. I'm currently writing a book about Yakima. I think there's a lot of concern in Central Washington communities and throughout the state around equity. I have a lot of concerns about equity and inclusion and how communities of color, low-income communities, immigrant communities are included or excluded. I think that's a huge area of need.
Great. Thank you. Rumiana, do you want to go next?
Can I say all aspects of
All
no
aspects.
one? I think
Well, plural, it's areas. So
areas. Okay. Equity, absolutely. But I think that taps into also that a larger level of how we think about parenting and caregiving, and where is the value, where do we put the value in that? So through policy change in supporting families, like specific, economic initiatives and policies that we can have, but also supporting professionals, who work in this field and really showing that support, with policy changes and environmental changes. So folks thrive. And we know, all of us know, that people go into this field out of love and passion for kids and families and communities, but also we need to make sure they stay there, they don't burn out, and they see our appreciation for the work that they do, again, with policy change that supports that.
great, thank you. Dennis, how about you?
As a school psychologist here, I've got to bring up mental health, right? Just broadly as a topic of concern, and going through our healthy youth data from Spokane County, we see levels of depression among adolescents, but 37% of our 8th grade population, 40% of our 10th grade population struggling with depression, similar rates of anxiety. We've got about 1 in 5 students that have seriously contemplated suicide. And when you're dealing with this at that scale as a school or as any educational entity, you have to have a strategic and targeted approach, right, for what you're going to be doing. And it can't just be individual psychotherapy, right? We have to have approaches, right, that are going to meet the need, right? And so I look at that as a really big issue, obviously, but just developing the infrastructure to meet that need.
Yes, as a mother of a teenager, I completely hear what you were saying. Amy, how about you?
Yeah, I find it interesting that we all come at it from a little bit of a perspective of the work that we have done over our career. And having worked with young children, I would really say everything we have known for years or learning more about brain development is 90% of who a child is done before they even enter our school systems. So what are we doing to support parents with the basic needs and with the support systems that they need, the understanding, the education, the relationships that really go all into supporting that child and the entire family and their support system in those first 3 years of life? I think that if we can get that right, then we don't have all the other issues that we're facing, or they're at a much smaller scale than what we're experiencing right now. But I think it goes back to say, if 90% of what's happening to a child is firmed up before they're 3 years old, we absolutely need to be focusing on those first 3 years and the support that goes into that.
Nice. I feel like cheering and crying after that. It's like we need to do it. Okay, so Amy, I'll start with you for this one. The next question is, what trauma-informed approaches are being carried out in healthcare, education, and among other service providers? And then what are some of the key characteristics of those approaches? I know that Vanessa Behan has really delved deep into this, so I'm excited to hear.
You know, thanks for starting with me, really. This is one I'd like to just say, somebody else go first, right?
Oh.
So somebody's got to go first. You guys will pick up what I miss. I struggle. I feel like sometimes we have new buzzwords for things like trauma informed.
Mm-hmm.
I think that's any different than what I went through in college, where you're talking about a holistic approach, person-centered, not taking the person out of the environment, right? We really need to be looking at meeting the person where they're at and meeting them in the environment that they're in, and then assessing how we support them in a relationship-based perspective. So I can speak a little bit about, things that we do at Vanessa Behan is really just trying to meet parents where they're at. There's no right or wrong reason for a parent to call and access our services. Everybody shows up with a different reason for needing that care for their kiddos. So we want to align with a parent and support them in that from a non-judgmental perspective. We want to be capitalizing on the moments that we have with the child. We know that we have a very small but big opportunity with them to give them opportunities to practice those skills of resilience building. We want to be a gentle, warm handoff, right? That relationship piece of saying, we may not be able to handle everything here with what we're doing, but let me connect you with the people that do and have a gentle handoff. I think it's building trust with our families. People don't come to organizations, they come to people. Healing happens in relationships. It doesn't happen because of a program. And so you have to have the right people inside that program. So just slapping a buzzword on it like trauma informed doesn't necessarily mean that it's going to work. You have to have the people in there that have the ability to do the work and to do it in a way that is going to build a relationship with somebody. Otherwise, that work is never going to take effect. So build on that.
That was beautiful. That was beautiful. And it makes sense with the first building block of hope being relationships, that it always comes down to relationships. Dennis, how about you?
Yes, I guess I'll begin my remarks by saying that we're seeing trauma-informed practices within schools implemented with varying degrees of success. But despite the fact that we've had, a lot of the research and data surrounding trauma-informed practices and care, it's been with us for a while. So certainly not new, but we're definitely not where we want to be. I think about this from a systems level approach, right? So trying to develop systems that layer interventions on top of one another to meet varying levels of need. And so for a school, that can look a lot like what you saw in the HOPE framework. So developing systems that facilitate two-way communication between parents and school personnel, right? So outside of parent-teacher conferences and outside of robocalls telling you that your kid's late for school or they missed another class or whatever it is, right? What opportunities are we taking to have conversations and inform parents on positive? And also providing things like parent education, parent and family psychoeducation, right, for some of those things. Back to my point about not being able to individually psychotherapy our way out of this whole thing, right? Educating and training communities on these things. Finding ways to increase feelings of safety and support within schools, right? So targeting things like bullying. We know that when kids feel more safe at school, right, we get lower levels of suicidal thinking and behaviors, right? And also more school connections. So increasing things that are going to make students buy into school, right? And taps into my colleague before talking about some of our early development challenges, right? If kids enter school and they're so far behind that they're checking out, they're not invested, right? That's not going to end well either. So I think of it from a systems level framework. We've got to have those things in there, and then we've got to have evidence-based targeted interventions on top of that. If I have a little bit of time, I'll throw out one, trauma-informed therapy approach that's been adapted to schools, and that's CBITS. So cognitive behavioral intervention for trauma in schools. So it's developed by Rand and a team from Rand and UCLA. And so those are, it's something that can be implemented within groups in schools. It's been modified to fit within school schedules. And so you can try to meet the needs of groups of students, you know, and through therapy, right? Not just individually. And it's something that we could be training school-based mental health practitioners in fairly easily. So, you know, it took up a lot of time, but I'll.
No, that was great. And I have a follow-up question to make it add to it. Are there any schools in Spokane that are in the county that are utilizing this or that are pilot
See,
sites?
in particular?
Mhm.
Not that I'm aware of. Doesn't mean that that's not happening. Unfortunately, right now, when it comes to mental health practices, we're in a political moment where a lot of mental health practices are being attached to social emotional learning practices. And so a lot of local school districts right now are vetting intervention curricula really closely to see if there are elements of SEL within it. And that's really slowing down the implementation of some of these things. So that's really an unfortunate byproduct of our political climate that we're in now. So I'm not aware of CVITs being implemented, but there are other things, definitely positive behavioral strategies that are being implemented, but I haven't seen it being implemented here.
Great, thank you for that. And Rumiana, how about you? Yeah, so what trauma-informed approaches are you aware of that are being carried out?
So I'm just going to read because I was reminded of that when Amy was speaking, and I hope I don't anger all those evidence-based researchers that are here on the call. But Carl Jung tells us that we need to know all the theories, master all the techniques, but as you touch a human soul, be just another human soul. And I really feel that this is in the core of all the trauma-informed or person-centered or strengths-based or healing engaged techniques that we've been taught through school, is that really in the gist of what we do in education, social work, healthcare, and so forth is going back to that. How do we touch others and others' lives is human souls, and acknowledge and honor their knowledge and their resiliencies and their stories, and also appreciate that honor to be allowed to be, you know, in their lives.
Nice, thank you. And Vicki, how about you?
Yeah, I don't know that I have a lot to add here. These have all been great examples of trauma-informed work. I would say, building on what Dennis said about systems, that I think I see the opportunity to consider trauma-informed, healing-centered work sort of in, I think Dennis, you used the word system, but I would say there's also parallel processes here, right? In the same way that we invite and honor a family story and a family's ownership of their needs and are responsive to that, we can do that at the community level as well. We can do it as we support the staff who are working in programs. So I would say there's a lot of parallel processes here that can and should and are happening at different levels. We may not always identify them as trauma-informed, quote unquote, but they are the same kinds of practices, and I'd encourage us to look for those. Thanks.
That's great. And then don't go off mute yet, Vicki. The next question is you'll be the starter, and it really builds upon that. So how should equity be considered in implementing trauma-informed solutions?
Well, if we believe we start with equity and not add it on at the end, then centering the experiences of individuals, kids, families, workers, and communities, I think is where we start. And also for good data folks, people who like research evaluation and data, on the other side of whatever it is that we're doing, always be sure to examine how is it working? Is it working for families who are furthest from opportunity, families of color, immigrants, low income? Is it working? And then make adjustments based on that. So start with them at the center, and then always be sure to examine on the other side, is it working? Those are the things I think about in my work.
Well said. Rumiana.
Yeah, I agree. We do start with equity. It's not just an addition to, it is not a trauma-informed approach if it's not equity-based and if it's not pursuing equity. And I really love what Vicky said of like starting where, you know, the most impacted population is, like who are we really looking at to serve. But not only, I want to also add, because I think we're starting to do a better job of inviting, you know, other voices and doing a community engaged research. I think we need to move past that now and continue to really partner and collaborate with communities. So not just leave it off at the assessment, you know, at research, gathering data, but also continue to engage and kind of really re-envision how our systems work, that no, we are not the ones who are holding, you know, all resources. Communities have their resources, they are resilient, and they know what it is to live in Spokane. We are here to support them, and we're here to maybe remove some barriers that we have created initially, so they don't have access to those resources.
Great. You said something earlier today that I'm hoping you can remember and repeat about Black maternal health. And do you want to remember what you said?
Yes, if we get it right. If we get it right, because there's some like comments about, oh, well, why do we have Black Maternal Health Week? You know, doesn't all maternal health matter? And it does, absolutely. But if we get it right for Black people and for Black mamas and for, you know, Black perinatal health, everybody's going to benefit. So similarly to racism hurts all, racism hurts all, you know, and we really need to address those issues. Again, equity should be really where we start, you know.
Nice, thank you. Dennis, what about you?
Yeah, I mean, I'm gonna echo what a lot of the panelists have said so far about starting with equity. And I'll kind of go back to, you know, some of my earlier remarks about engaging your community, right? And having two-way dialogues about what the most pressing needs are. You know, you can try to educate yourself on what you think certain groups may need, right? Or what practices have been effective, or this, that, or the other, but you're never really going to know the answer to everything. And the best way to come across that information is having those dialogues, right? Being willing to listen and adapt your practices as you're going forward, right? And being sensitive to the needs, right, of the community, right? And then also kind of taking a look at some of your own results, right? So if that's a school, right? What seems to be a problem? Do your community members agree with that? What kind of solutions can you come up with together, right, to address it? But so I think you have to start there.
Great, thank you. And Amy, you want to finish this one up?
Yeah, I think the only thing I have to add that hasn't already been said is that, well, it already has been said, but that, you know, lack of equity has really caused a lot of the trauma that we're trying to now fix. And so it goes back to what Vicki said, is you have to start from that equity lens and center it around that work first, because that's a lot of times the trauma that's happened.
Yep, that's true. And then stay off mute because I'll have you, we'll just go background. So what have you found to help facilitate successful implementation of trauma-informed approaches to support families and children in achieving their optimal health and well-being?
I think I'd kind of go back to what I said.
Yeah.
Really, it's about caring individuals and being non-judgmental. I think that's one of the things that we really impress at Vanessa Behan is that when a family calls, if we pass judgment on them, we lose them. They're not going to come back and trust us and get the help that they're looking for. So we have to come from a place of whatever's going on in your life, whatever you define as a crisis is what we're going to hold, and we'll work from there. And so it really is about meeting the individual where they're at and really trying to look at them as that individual, right? We are so often asked, tell me about the generic example of who a family is that uses Vanessa Behan, and there isn't. There really isn't a generic family. It's everyone is individual. Everybody has their own reason. Everybody has their own path going forward. So I think the other thing I would add to that is that we have a tendency, I think, in our society to have no's readily available instead of saying, how do we find the yes? So instead of saying, well, that's not what my program does, why couldn't my program do that? Or how could my program do this? Or if I truly can't do this in my program, how do I get you to the right person that does do this program? And instead of saying, here's a phone number and a bus pass or an address and good luck with that, doing that work with them, right? It's that what I said earlier, that gentle, warm handoff so that a family doesn't feel lost in the system. And I think that that we get very close to that line of just saying, I give up. It's just too hard to try to navigate this. And so what are our systems in place doing to contribute to that? And how can those of us that have the power to change that, truly change that so that it is us all working together? And I think sometimes it means setting aside our egos and not being territorial about my program or my funding or my impact, but this is a collective. We together are trying to figure this out for the betterment of those that we are all serving for our entire community. So I think this kind of goes right back to relationships and individuality.
Yeah. Great, thank you. Thank you. How about you, Dennis? What have you found to help facilitate successful implementation?
Yeah, so I'm going to approach this from a different perspective here as kind of an applied scientist that kind of studies just implementation barriers in general. So one of the things that I look at are mechanisms within organizations, in this case schools, for ongoing professional development, right? So for whatever it is to implement your program, whether we're talking about implementing interventions, whether we're talking about how we're communicating with parents, families, right? Knowledge of our programs. Everything from how we're greeting people at the front door, right? So having those procedures in place, right, to continuously develop the folks that are working and serving within the schools, and not having to bring it from out of town or across the country, bring in expert X and have them present what's your mechanism for ensuring ongoing professional development. That's this one big thing that I found. Another thing is developing strong teams. Developing strong teams so that the onus isn't on just one person, and also so that there's communication between team members from different perspectives. So in a school, you've got administrators, you've got teachers, parents, community members, psychologists, etc., that bring a different perspective. And when we're talking about individual students, that allows you to get different lens, right, for those students, and identify some of those protective factors, right, and some of those resilience characteristics that we were talking about. Those are the two things that stick out to me.
That's great. Thank you. And Rumiana, poor Rumiana, the lights are being shut off on us in here.
It was. No, I just decided to go with the new lighting here. So, I'm sorry. I don't know. I have so many thoughts around this, but it's when we talk about change, and especially if it has to be on the system level, there's a lot of resistance because many reasons why. But what I think what I found to be the most successful part is around rally, like as Denny said, identify those like who's going to be on your team, who are those like really champions and early adopters of the ideas, who are already there, who are getting it, and being able to engage them early on to build that momentum. And I personally get excited when there's like a new idea, when there is something bigger than me, that I can work towards. I do get discouraged when we talk about systems because, they're big and they move heavy, and many like years have to pass to see something small, incremental, right? But I kind of echo what Amy and Dennis both said, that systems are built of people. And we know, like, we can work with people and we can influence people when there is this exciting thing that we want to dream big and we want to thrive. We don't just want to be resilient and survive. We want to thrive, in this community. And we all love our community. So I think that's where I really see where we can influence that, system level change, when we tap into people's pride and people's love for community, for the work they do. And then support them on that individual level of human to human, like how can I, human being to human being, how can I support your work? Because we get it, like we all been there, we are practitioners, we know how taxing it is, especially, like 3 years of COVID, 2 years, I don't know how many. And it wasn't just COVID, like systems were already taxed. So again, we have tremendous potential, incredible opportunities, to create what we want. But we have to think about, what do we want? Not just what do we want to work against, but what do we want to create, in the community.
Great, thank you. How about you, Vicki?
Yeah, so I think I'm going to take a little different tack because it's been so well said. What's needed in the programs and services and communities that we're working in. From a public policy perspective, I want good policy that's going to support the kinds of programs and services and efforts that have been talked about today. I want more of that policy. But if I had to choose one policy that would make the biggest difference, I absolutely think that if we reduce childhood poverty, we'll help families. Fewer families need some of the services we're talking about. And it's not talked about enough that 2021 was a record low childhood poverty rate for Washington State and the nation. It was also a record low number of children coming into foster care, and that is not a coincidence. Reducing childhood poverty makes a difference. It puts money in the hands of families that they can direct, they can decide what to do with, and it reduces pressure on all of our systems that aren't well funded enough to support the families who need us the most. So that would be my number one policy.
That was great. So we're down to the last question, and then it'll open up for audience questions. So the last question, and this is where you can just really let loose, is what are some gaps in our understanding? But so it's, what are some gaps in our understanding or information as a field that need to be filled through research to help develop and implement more effective solutions? So where's the opportunity to understand more? Do you want to start, Amy? Oh, sorry. It's whoever I look at.
I've been following your system. You threw it off on me. I guess I sometimes challenge the fact that there is so much research out there, so much going on. We have so much data. Are we connecting the dots? Are we connecting the dots correctly across the systems? And making sure that all the right people know that information. Sometimes I feel like we in the social services all know this really well. And then you have a conversation with somebody in the world that's more philanthropic or, and there's a disconnect in understanding how important the long-term trajectory of success in our community is and where that starts at. And I love, Vicki, that you're talking about childhood poverty and how that could just change the outcomes for so many people.
Mhm.
But we don't all agree on that, right? Not everybody understands that. Not everybody connects those dots. So how do we make people understand those connection points of the research that's already been done and use that to our advantage? I mean, I just think of the ACEs study, right? We know so much about what causes the trauma. Why are we not putting more in place around the prevention side of that, gating those things? So, and I'm sure so many other people have equally as good of better answers. So I'll stop there.
That was great. Dennis, how about you?
You know, when I was looking at this question, I latched on to something really specific, actually. And so I hope I don't get too granular with this, but I was actually thinking about some of the gaps that exist within research, you know, especially, you know, from that equity lens where, you know, a lot of our research is done on white or Eurocentered populations. And I thought about something as simple as, you know, parent education programs, right? Where we bring parents in and I'm going to tell you what you should do with your kid. And I'm going to try to get you to implement this authoritative parenting style and switch from another. And I think about a paper that I read recently that was researching single Black parents that from the outset looked like they had an authoritarian parent style, but it took a deeper look, you know, from an ethnographic lens. It was more of a, they called it a no-nonsense parenting style that was actually very adaptive, you know, within the community context, right? So doing more research with ethnic minority populations, right? And kind of understanding those contexts better and bringing that into our fields is very needed, because we come to the table with this one answer sometimes, this one solution, apply it to everyone, and it doesn't always work. So that's what came to mind.
That's great. Thank you. Rumiana.
I think, oh my gosh, I have so many. Just talk to me, and I can tell you what just Dennis said, like, got me thinking around different trajectory, because you're gonna do research in what you know. And yes, we're all curious. That's why we become researchers, because we want to know more about the world around us, but your lens is through your own personal experiences. So sometimes even the questions we're asking are because the way we are and the way we experienced that. And I know we say we don't, you know, we try to be more objective with quantitative research, and true. And the way we formulate questions are still, you know, from what we know and what we've experienced as just people, not even as professionals. So there's huge gaps around how do we engage community to do research with us, not just to go and ask questions from communities, but, and I know there's like different participatory models and things like that, but I want to see even more. I want to see community as co-researchers and as owners of their data. And we know there's a big push and movement around this. But we also want to show that we have the trust and respect in community to do their research and highlight, you know, the findings of those research to feed their communities back, you know, to meet those needs. So I'll focus on this, but I have so many other ideas. So again, let's talk. I'm a recovering academic, so I have many ideas.
Vicki, how about your thoughts?
Yeah, I won't belabor this, but I think I would agree with what was just said about the community pieces. I think the only research worth doing anymore is applied research, and doing it in partnership with community and figuring out what we can do to demonstrate effectiveness and to strengthen those kinds of community-based interventions, as well as public policy interventions that are actually going to move the needle. Thanks.
That's great. Thank you. And I would like to say that we are, oh, no, we're not. I was going to say we're on time, but we're 10 minutes late. Sorry. So opening it up for audience Q&A, and I just noticed that Carmen Pacheco-Jones put a really great question in here. And it says, when individuals are consistently met with resistance from a system level, why does the measure of resilience need to be the burden of the individual? Why not support system responsiveness instead of exclusion and oppression? That is a great question. Who wants to?
Absolutely, 100%. And that's where, that's another gap of what we don't have in research is like, how do we measure community resilience? And how do we measure also the responsiveness of a system, you know, not just like provided services, because we can measure that easily, but also the culture and how, you know, those people, those families are met by the system. I totally agree with Carmen here. Yes.
Yeah, other thoughts?
Yeah, I read the question. It came up when we were talking about resilience early on in our conversation. I read it as rhetorical in a bit. I'm not sure, Carmen, if that's how you meant it, because of course we would all agree that the system responsiveness is, instead of exclusion and oppression, is absolutely what's needed. I think often those systems of exclusion, they exist for a reason, right? Systems produce what they produce. They were built for a reason, and they produce what they're built to produce. And it's not an accident that systems exclude. It's not because someone just wasn't thinking right one day. They are built that way. The practices are institutionalized, assumptions are institutionalized, and there are ways to measure that. I don't think it's, I mean, I measure whole communities, but I don't think it's all that difficult to find evidence of exclusion and to bring that to the attention of systems. But the processes by which the remediation of those systems is done is often political. And those are different interventions, right, than the kind we're talking about here today that are family to family or even community based.
Great. And you guys can all see her. Thank you, I'm sure. So any other questions? We have about 7, well, no, we have less than that because there needs to be a wrap up. So any burning questions out there? All right, well, I will turn it back over to Ashley then.
Wow, I have so many thoughts and follow-up questions myself and things that I want to follow up on and read more about. And I just want to say thank you to all of our presenters and panelists and everyone for attending, for giving up this kind of time in your evening. And it takes so much preparation, I know, of your thoughts to be able to so quickly run through so much great information. And it's so impressive, all of the information that you all provided us today. And I just want to say thank you so much for that. I appreciate everyone's time being here. What will happen kind of next steps for this is that we will have this recording available. It'll be available on our HSRR website. I will ask maybe Amy or Brittany to pop that in the chat so that you can access that. We will also send an email to let you know that this recording is available, as well as the slides. You can also keep an eye out for a follow-up survey to help us improve and help us know how we did tonight. We will look for another event. We typically hold events around this time of year and again in November. And our next event will be a similar topic, and that we've decided to focus on kind of trauma and supportive trauma within the veteran population during next November around Veterans Day. So keep an eye out for that event as well. And again, just thank you to everyone for the great information tonight, and to our committee for kind of keeping this gathering going, and for all the work that goes into that as well. So have a great night, everyone.